What circumstances do you find that the flexor tendons or the extensor tendons are injured? Any type of sport activity where they're injured?
Like I said, it always seems like we go with the sports. So fall is football season, it's volleyball season, and lacrosse. So by far and away for football is, they call it jersey finger. That's where patients will reach out to grab the jersey and they'll pop that tendon off. So instead of it cutting it, they actually pull it away from the bone, and that will retract. Similarly, it has to be fixed pretty quickly.
What about baseball season, other times of the year?
Baseball season, commonly what we see, we'll see more fractures and little league stuff. So for some reason, the thumb gets beat up in baseball season, whether that's catching a ball or a hop, or catching one on the thumb. And basically in a boy or girl that's not yet reached skeletal maturity, there's still growth plates. Those aren't strains and sprains. Those are fractures by far and away. Where there's really a skier's thumb, where patients always talk about gamekeepers, that's more of a ligament injury in an adult. A younger person will tend to pull that bone off, so it's an avulsion injury, a true fracture. Whereas older people, old people like me, will actually tear the tendon and get a gamekeeper's thumb.
If somebody hurts their tendons, hurts their fingers, hurts their hand, what's the biggest mistake that a person makes of not recognizing something's going on?
Not getting in. I think that you'll often see, and we all do it.
Sure.
They'll just put a splint on there and just think they stoved it up. Generally, that's a ligament sprain. Well, a ligament sprain means a tear in the ligament. The only question is, how severe is it? If there's instability associated with it, like at this knuckle, it's very common to hyperextend it. Patients say that the trainer or someone put it back into place. There's actually a tear there that we need to judge and see if it's unstable. We need to protect it and buddy tape it, and sometimes even place a blocking splint on the back. It allows them for full motion, but then we'll slowly bring it up about 10 degrees a week to make sure that they get all their motion back. So just locking a knuckle down or a finger down can create a lot more problems down the line because it gets really tight, and then you gotta work in therapy to get it free.
So the best thing, if you've got a hand injury of any kind, is to be sure that it's checked out properly so that you get the proper kind of treatment.
Sure.